So atrophic dermatitis, also called as eczema. So it is a common chronic inflammation of the skin disease. Commonly, we refer atrophic dermatitis, a superficial inflammatory process that is primarily involved epidermis and that is characterized by pruritic lesion. It is associated with family history of the disorder or allergies, asthma, or allergic rhinitis. So the person who have allergies or asthma or allergic rhinitis, they have chance to develop atrophic dermatitis. So it is a trigger factor. The basic pathology, a defect in the skin barrier mechanism and increased susceptibilities to allergies and environmental irritations. So the major goal of the management are to relieve the pruritus, like if you give them antihistamine, diphenhydramine, reduce the itching, or lubricant to the skin, reduce inflammation like topical steroid, and also prevent or control secondary infection. So we have to identify and avoid the trigger factor so we can prevent it. The different forms of eczema, like infantile, usually begins at 2 to 6 months of age and decrease in incidence with the aging. Spontaneous remission may occur by 3 years. Childhood may follow infantile form, occur at 2 to 3 years of age. Also, pre-adolescence and adolescence begins at about 12 years of age and may continue into early adult years or any times in their life. In here we can see what are the signs and symptoms. Sometimes patient present with redness or dry skin, we call xerosis. Okay, and also the silvery shiny skin, and also we can see here itching or papules and vesicle. Papules basically form elevated the circumscribed lesion but smaller than 1 centimeter in diameter, whereas the vesicle is smaller to papules but it is full by fluid. Sometimes patient present with oozing or crust over the lesion. Adolescence and early adult form commonly occur in antecubital or popliteal area, means where the skin thickness or skin is thicker. In this picture, we can see chronic inflammation, okay, on the skin, what is lead to atopic dermatitis. So what are the nursing intervention? So avoid the exposure of the skin irritant such as soap, detergent, fabric softener, diaper, and powder. So we have to identify and then avoid the trigger factors. Avoid excessive bathing and washing the affected area. Bathing water should be tipped and the skin should be lubricated immediately after the bath. So also intermittently apply the cool wet compresses for short period to smooth the skin and alleviate the itching. Also, pat the skin dry between cooling treatment. Administer antihistamine and topical corticosteroid, and definitely as prescribed, or corticosteroids are applied in a thin layer and rubbed into the area thoroughly. Antibiotics may be prescribed if secondary infection occur. Prevent or minimize the sketching, keep the nails short and thin, and place the gloves or cotton sock over the hands. Eliminate conditions that increase the itching, such as wet diaper, excessive bathing, or also some kind of cloths or blanket. Rough fabrics or furry stuffs, animals exposed to latex should be avoided. Reinforce instruction to the parents to wash the child's clothing in a mild detergent and rinse it thoroughly. Also, putting the cloth through a second complete wash cycle without detergent with a minimize the amount of residual remaining on the fabrics. So what else? What are the other nursing intervention? Let me recap it. Daily skin care is important, and tepid bath with a mild soap. Apply emollients right after. Also, no bubble bath or harsh soap. Also, wear a soft cloth. Wash the cloth in a mild detergent. Avoid heat. Avoid humidity. Also, minimize the scratching and keep the fingernail short and clean. We educate the instructions to the parents in measure to prevent skin infections. Educate instructions to parents to monitor the lesion of sign of infection like honey color cast, sounding erythema, or look for immediate medical intervention if such signs are noted. A child with an integumental disorder needs to be monitored for sign of either a skin infection or a systemic infection.